tanto, como ha dicho antes el doctor Tedros, no ha acabado esta crisis y el Gobierno de España continúa siguiéndola muy de cerca y monitorizando cada uno de los pasajeros, también, lógicamente, los asintomáticos. Y respecto a la situación humanitaria en Gaza, nosotros hemos dicho tres cosas. La primera es que se tiene que garantizar el acceso total a la ayuda humanitaria a la población gazatí, que desgraciadamente hoy no se garantiza ese acceso total. En segundo lugar, que se debe respetar ese alto el fuego y que las partes se tienen que sentar para dar una solución política que inevitablemente pase en el medio plazo por el reconocimiento del Estado de Palestina en una coexistencia pacífica con el Estado de Israel.
Yeah, thank you, Your Excellency. On more cases, as I said it in my speech, we would expect more cases because, as you may remember, the index case, the first case in the ship was on April 6th. And until the report was confirmed as infectious, that's around April 24 or 25, there was a lot of interaction actually with the passengers. And as you know, the incubation period is also 6 to 8 weeks. So because of the interaction while they were still in the ship, especially before they started taking some infectious prevention measures, because of the interaction, we would expect more cases because of some of what happened during the travel actually, until hopefully the interaction until April 30th. After that, of course, they have improved the measures. But the second part is passengers now have left and they're in their respective countries. So as Prime Minister said, the countries are taking responsibility and all the measures are being implemented by countries. Of course, as previously asked, earlier question, there are differences from country to country. This could be because of local situations. But at the end of the day, the countries actually take responsibility. And I hope they will take care of the patient, the passengers, helping them to the best they can, and also protecting their citizens as well. That's what we expect. On Palestine, of course, there is improvement in access, improvement in medical evacuation. We do medical evacuation as well. But still, it's not as what one would expect, especially it's not full access as Prime Minister indicated. So we need full access. For instance, if you take the number of trucks that should cross to Gaza, the number of trucks should be average 600 per day, but that's not happening. So I think there should be improvement on that, and the amount of aid that the Gazan residents need should be delivered on daily basis. The 600 trucks are actually the indicator. The other problem is when the number of trucks increase, a good number of them are commercial, but many of the Gazans actually can't afford even to pay. So we have to make sure that the trucks who cross actually, by and large, are humanitarian ones. So people can have access to the humanitarian support. So there is improvement, but still not full access, and still there are challenges. And as you also know, because of the destruction of the infrastructure, the hospitals, the health system literally collapsed. So that's another problem, rehabilitating that and making sure that the people who need service are getting service is our priority. But still, with the level of distraction, access to health services is minimal. So with that, thank you, so much. Glad to have this opportunity. And again, I would like to thank Spain, and especially Prime Minister Pedro Sanchez, for the outstanding leadership and coordination. I know this is a model, and I hope other countries also learn from this, not just the obligation part, but the compassion and solidarity that Spain has shown. And I repeat again, in this divided and divisive world, which is in a very dangerous trajectory, I think what's important is kindness and taking care of each other. So thank you again for your leadership, Your Excellency. Very proud of Spain and very proud of you. Thank you.
Thank you. Muchas gracias.